Welcome back to another episode of the Higher Ed Podcast. I'm your host, Kamar DeJarnett. I'm flying solo today. Have a great guest with us. Dr. Bonny Kehm is here, and it's really a pleasure and a great opportunity that Dr. Kehm has found some time to meet with us. Could you please introduce yourself to our audience and maybe give them a bit of your origin story? How'd you get here?
Sure. Yeah. Well, hello everyone. Thank you for listening, and nice to be with you today, Kamar. I'm Bonnie Kehm. I am the founding dean for the College of Nursing and Health Sciences at Columbia Southern University, 100% online university and college, and we founded that college in January of 2025. And a little bit about me and my background is clinically, I'm a pediatric nurse. So I started my nursing experience in the early 1900s. And that sounds ancient. That sounds ancient. I started my academic career actually as an LPN, and then I transitioned from an LPN to an RN, bachelor's, master's, PhD, and beyond. And when I was working in the hospital taking care of very sick children, um, part of nursing and healthcare is teaching. And I had the opportunity to not only, support and teach families and patients, but teach fellow nurses and others. And so that brought me into academia, where I then transitioned into academia and higher education. And have been, dean, associate dean, faculty program director, and faculty for 20 plus years. It flies by, Kamar, so fast. And I've been in that role and capacity for a while. And then in right around when COVID hit, was appointed by the governor to the Missouri State Board of Nursing, and have served and continue to serve in that leadership capacity that oversees all nurses in the entire state. So you're talking about 150,000 nurses and schools of nursing. So that has been a wonderful volunteer experience and continue to do that. So that led me to founding a college of nursing and health sciences.
Wow, wow, you're a big deal. You're a big deal, big responsibility. So, two-part question. When did you kind of first fall in love with higher ed? But also, when did you fall in love with higher ed leadership, right? Because those are two different concepts.
Yeah, and they are, and you're exactly right. I'm not sure when it happened, if I can pinpoint the moment. It just happened organically as I was going to school. And it was one of those opportunities of not having a traditional path to education. I didn't, go to the traditional university and get my bachelor's degree. Like many of our students and many folks out there that are probably listening, it's been a career ladder concept. And so the more I learned, the more I realized I didn't know what I didn't know. And when I learned more and got my, associate bachelor's, then I really took a look at what higher ed is. What can it provide to our communities, to
Sure.
myself? What should we be expecting of what the ROI is on ourselves, and expecting that higher ed initiatives and leadership. And so it was at that point, probably as I was, going with my bachelor's and master's, I'm like, maybe I have a voice in higher ed, and maybe there's an opportunity to create something that caters to all of us in our unique academic journeys and our unique work journeys. And so that was probably um, in the late 1900s, early 2000s, when I really took a look at leadership and higher ed, and fell in
Sure.
love with it.
Sure. Absolutely. So, from the person as accomplished as you and kind of had the career rise, I'm curious, what did COVID mean to you in a sense of, and I know it was a tragedy and it was tough, but I think it was, you know, maybe outside of 9/11, it was one of those times when we as a society realized that, hey, our heroes don't necessarily wear these capes and can fly. They actually wear scrubs and they work in hospitals and doctors' offices across the country. What did that mean for you?
Yeah, and that's, I love that. Heroes and capes. How that's a good soundbite. I want to borrow that. It meant a lot to all of us globally, not just our communities were impacted, but everyone was, and no one could escape it, no matter how much we wanted to. And so what that meant was re-envisioning education and higher ed. And it created the opportunity to do that. And especially being on the State Board of Nursing at the time that oversees,
Sure.
clinicals and regulations and all the nurses of we can do this differently. And I think in higher ed, what that meant was quickly transitioning to online along a lot of traditional universities, brick and mortar had to pivot like
Right.
that. Um, my university, fortunately, has always been online for the last 30 plus years. And so it was an easy transition for us because we'd been doing it. So a lot of folks looked at us and how we can master that. But it was transitioning to online and it hasn't changed. And it's only going to continue to be that way, which is a good thing because what that allowed was access to education. And especially in rural areas or underserved areas, all of a sudden people could go back to school and they didn't have to worry about how am I going to get there? How am I going to
Right.
get to school? How am I going to pay for the gas money? And so that COVID, that was a positive thing coming out of COVID. It shifted and changed higher ed, but certainly for medical professionals and healthcare.
Absolutely. So you got to help me with this one, right? When I think of nursing, I don't think of online. So I know one of your passions is, and we touched on it just a tad bit a second ago, is expanding access through online education. Tell me about this mission, this passion, and what does it look like? How does it happen?
Yeah, and that's a common thing. Like, wait a minute, you're direct patient care. You're putting hands on people. How you do
Sure.
that remotely? So our university is post-licensure, so they already have their RNs, whether that's a 2-year degree or a diploma. And we continue to upskill them with bachelor's and master's degree and then dual degrees as well, where they can get their bachelor's and master's in less time. And so how we do that online is through innovation, and we embrace AI and we
Oh,
embrace technology. And so instead of going into a simulation lab physically, we've embedded it within our curriculum. So our nurses are still doing the head to toe assessment, but they're doing it with an AI,
oh
um,
wow.
a virtual clinical simulation, a digital patient, and the digital patient is responding back to them, and they're talking to that patient. They could
Oh
type
wow.
or they can talk. So it's really embracing the technology and providing that education and that support, but not being afraid of it.
Right.
Doing the research of you don't just throw in bells and whistles for the sake of
Right.
bells and whistles, but be strategic about it. But understand that we can do that, and that's the way we've been. And technology has always been a part of healthcare. It's one of the first that we continue to embrace with electronic health records and
Sure.
robots that are coming
Right. Right.
coming to your hospital soon.
Absolutely. So when you think about AI and higher ed and nursing, it doesn't seem like you're afraid of it or think that jobs will be lost. Can you maybe speak to that in terms of it seems like you have a much more positive view of what the future looks like?
I do, and I think we have to be cautiously optimistic. It's here. It's been here. And AI, and I've heard folks say, oh, AI is going to replace people. I don't believe that. It hasn't been my experience, and maybe others. AI, I don't believe will replace people. It'll replace the people who don't learn how to use it.
Gotcha.
And so we need to use it as a pilot, something to make our work more efficient. But we need to use it ethically and responsibly and understand where those boundaries exist.
Sure.
Teach and learn of how we can ethically use it, but embrace it because it's here, and we need to be innovative and innovators. And for one of our degrees is actually a master's of nursing informatics, so it has AI embedded in that degree and data
Nice.
analytics. So we're learning with it, we're learning from it, we're learning how to use it responsibly, and we're learning how to teach others to do it and not to be afraid.
Absolutely. Okay. So you see the future and you're actually embracing it and actually implementing it and including it already.
Yes. Yes.
Awesome. Okay. So I know another one of your passions, and this is kind of a big topic. I would also say post-COVID is affordability without compromise in higher ed. What
Mhm.
does that mean when you say it?
Well, it it isn't, yeah, it doesn't mean less quality. For example, affordability means good quality, but building tuition models that are cost effective for students. And we shouldn't have to upscale. We shouldn't have to go into debt to upscale. We really
Sure.
shouldn't have to. And there's no reason for that. And so when we say affordability in higher ed, for example, our university provides all learning resources, including the textbooks, at no cost to the students.
Wow.
No cost. And so
Okay.
that's affordability. And
Absolutely.
healthcare books are like this big and they're heavy and they're expensive. And so when you don't have to pay for that and that's embedded in the course at the onset, there's no delay in that. And affordability is also understanding that it's not a high tuition. We should be close to what community colleges pay. Why shouldn't we? And so affordability matters, and making access to folks that can get education at an affordable price by providing no cost learning resources, by having it online. They're not spending the cost for gas or brick and mortar. It's just one of those little pieces of, yeah, we shouldn't, and we should be transparent with
Sure.
affordability. So when someone goes to a website, and I've gone to many universities' website, there's these, in higher ed, we call them hidden fees.
Right, right,
Yeah, okay, it says the tuition is this, but then when you get into the course, it's every 6 months you're charged some.
right.
So there's no hidden fees, and there shouldn't be, because we really need to be transparent, and especially in healthcare and nurses in particular, consistently voted as the most trusting profession. So if they're trusting us to go back to school with us, then we should be able to be trustworthy
Sure.
to not have hidden costs for them.
Absolutely. Yeah, I did an episode, I want to say Wednesday of this week with Jeremy Bean from Penn State University. And he was kind of discussing how, I guess in the past, 10, 20 years ago, in terms of education or the expense, maybe 70 to 80% was coming from the government, and then 20 to 30 was kind of out of pocket coming from the student and their family. And he's saying now it's shifted to whereas 70 to 80% is actually coming from the student and their family, and 20 to 30% is coming from, the government or, added assistance. Is, I guess, when you think about that, that does that kind of feed into, one of the reasons why you're so passionate about higher ed being affordable?
It is, and from my own personal journey as well, I paid my education entirely myself, and so, I'm still paying off those student loans. I'm still paying off those student loans, which is great, and it's a good thing, but I didn't have that opportunity to really go to affordable school because it didn't exist.
Sure.
And so that has been our experience of, you shouldn't, if you wanna take out student loans, you certainly can, and we support that, but you
Right.
shouldn't have to. It should be able that you could budget this,
Sure.
and make it affordable. And I'll give you an example of, and I'm gonna shout out to Dr. Frida Braddock, who is in our dean of our College of Ed, at our university. She has an amazing program, and it's so trustworthy and affordable that my daughter, who just graduated as a teacher
Oh,
in May
nice.
from our school here, is now enrolled online at CSU in their education. But she took out,
Congrats.
yeah, I'm so proud of her. So proud of her. Proud mama moment. But she hasn't taken out any student loans. She only pays a couple $100 every term. And so that really how it should be. And then she's obviously not paying for costs for textbooks or anything
Sure.
else. So we really need to live the mission and walk the talk.
Absolutely. So this next question is kind of two parts, and I'm curious, What is it that you think that higher ed is getting wrong that we need to fix in these upcoming years to, survive and continue to provide value? But also, what's something that you believe higher ed is getting right that we need to continue to drive into the future?
I think I'm gonna write this one down. So wrong and right. So I think there's certainly opportunities in higher ed, and there's opportunities for improvement always. And I think where that lies is listening and understanding what our students' needs are.
Sure.
And that comes from understanding what the workforce needs are, and that comes from talking to employers. And so I think that's where the opportunity lies, having those conversations, being open to those conversations, and realize we don't know everything. And when we have our advisory boards or employers, and we have our students, and we have others giving us their ideas and thoughts of what they want for their learning, we should listen to that. And then the opportunity lies, and the positivity of that is then you come at a curriculum or a college with a very holistic approach, because you're really meeting the needs of the community. And I think what we're doing right, and certainly I've heard of some colleagues as well, and we embrace this, is talking to. When we founded our college in nursing and health science, we actually didn't start with a curriculum. We
Okay.
went out and we talked to nurses and healthcare workers. We went to the hospital and said, what do you want? And that's how it grew organically with the degrees we want. How do you want it delivered? So we recorded our lectures as podcasts because that's how they wanted it. So
Mm,
listening to them and listening to the employers of where your needs are and how can we support you in this, is something that I think some places continue to do right. I hope we certainly do. And so that's an opportunity and a challenge I throw down to others to accept that gauntlet, to listen,
a-
be more open.
absolutely. So, and I want to follow up on that a little bit. You know, workforce ready curriculum in healthcare. A lot of times when I talk to people, they say that's it, especially for healthcare, right? You talk to the employers, and then you just basically kind of give your students what they need so that they can get out there and work and kind of get the career that they're looking for and that they need to provide for their family. I think you're in a unique situation with, I mean, nursing, they always a shortage. I think people go into it knowing, hey, if I can succeed here, I can have a great career. And then they want to grow in that career. How essential is that marriage, to the, kind of the community and just employers across the country?
It is essential. You really have to listen, and you have to listen to everybody. And then that's where you pull in the technology and embrace trying to mirror what's happening in the real world and pulling that into an online environment with telehealth and simulations, case studies that really mirror what they're experiencing. And just like our patients, when we see, for example, our digital virtual simulations, our patients we see in the hospital change by the hour, if not by the minute. They come in for one diagnosis and then something else happens. We have to pivot.
Sure.
So the technology in the course has to do that too. And so they have to change. For example, our virtual operator, they came in for a diagnosis, and then a minute later, they're exhibiting other symptoms. So it's mimicking what the real world is, and ensuring that they meet those needs of what exists in healthcare right now.
Absolutely. The enrollment cliffs, do you guys feel that at all in nursing?
It's surprisingly we don't, because we have 11. It's not surprised. It's not surprisingly, because we're a college founded by nurses for nurses.
Yeah.
So we speak the same language. We understand what our needs are, and we have 11 starts a year. So we're not seeing a decline. We're actually seeing an increase, and there's no enrollment cliffs because we don't have a limit to the number of students we have. We're online, we're post-licensure. And we're creating more educators. So one of our master's degree is a master's in nursing education. And part of the cliff, or the numbers of not being able to get enough students in pre-licensure, is because there's lack of faculty.
Sure.
And, there's various reasons they're retiring. Folks aren't going into that discipline. So we're actually growing our own faculty with our degrees to help not only our college, but to help our community and pre-licensure programs so they can enroll more, get more nurses out there to take care of all of us, and then we can upscale them from there.
Absolutely. How important is student support in virtual environments as we become more of a virtual world?
Oh, it is one of the student and faculty. Yeah, I need support. But yes, so having robust student support systems 24/7 IT support is important because we know that, you know, there's a lot of shift work in healthcare and it's not a 9 to 5. You're working weekends and evenings. So you really have to have that support when they need it, how they need it in that moment. So that's a math center, that's a writing center, that's tech supports, and that's also just mental wellness and self-care support. And I think the opportunity lies too. We've implemented self-care webinars once a month for faculty and students, and everyone's invited to let's just talk about how are you doing? School aside, but how are you? And doing that pulse check. So having that support holistically, not just academically, is really important. And having a robust writing center is really good because in healthcare, we write in truncation. We
Right.
chart and we chart just symptoms and signs, and so we're not used to writing. Not that we can, it's not something that we do normally in our profession in the hospital setting, and so having a writing center to support folks, for them to be able to submit a paper and get feedback, is really important to make them, feel connected.
Sure, sure. How essential is the continuing education and post-licensure nursing education? Is it a must? Do you feel like the nursing community is aware of how kind of pertinent it is?
When I was going through my academic journey, I didn't realize, I knew I always wanted to continue but I didn't realize how important it was. And then, as I said earlier, I didn't know what I didn't know. And as I kept getting more degrees, it was like, oh, I remember in my LPN and my associates program, I learned about, the essential knowledge was so important in there of, hands-on direct patient care. It was later in my bachelor's and master's where I learned the theory. Why am I washing my hands? Why am I doing this? And this is all based on evidence. So it's really important to continue to upscale. And there's data and there's research out there that validates, with the higher education you have, typically minimum of a bachelor's and beyond, there's better patient outcomes. And so all that's based on evidence. So it really is important not only for our patients in our community, but ourselves. We want to be the best version of ourselves. And the best version of ourselves is investing in ourselves and making ourselves happy and proud and our community as well. So it's really important. Data supports it, and something that I would certainly encourage everyone to continue on in and just learning more.
Absolutely. So I'm curious, right? Because everything to me, listening to you, you're very kind of forward thinking. You're embracing what's coming, you see what's coming, and you're doing everything to prepare staff, faculty, students for what's coming. I'm curious though, because higher ed sometimes, I'm just saying sometimes, can be somewhat stubborn and rigid, right? How do implement a lot of these, this change management and forward thinking strategy as you're kind of building the plane as you're flying it, right? Because all of this stuff is happening today in real time.
And that's funny that you said that because when we're building the college, it's like living in the house and building it. And so I like the plane example. That's exactly right. Because you don't know what the future is. If we all knew and we had this crystal ball, then let's go play the lottery tomorrow. But you look at evidence and predict it and those. So how do you manage change? Theory is by listening, being
Right.
accessible, and listening to all stakeholders. And understanding that it's good to have different divergent ways of thinking. Maybe that's not the best path to go on. Maybe there's a blind spot we haven't seen, but being open to that and understanding, what the needs are. Micro credentials, certificates. It may not be at this time that somebody's able to complete the degree, and that's okay. But maybe they can pop in and they could take 3 courses and get a certificate in something that helps
Sure.
improve, their care. And so it's really being forward thinking, managing that change, taking care of yourself and taking care of others. And it's having partners in the community. So it's having learning partners with multiple organizations, not just the traditional, um, hospitals. Those are important and those are really, really valued. But it's talking to, the scrub company, and it's talking to others as well to really have a holistic approach of what are you seeing?
Sure.
What are their opportunities?
Absolutely. So when you're building the staff and kind of working with the staff, if you go back, say 5, 10 years to now and then moving forward, are you hiring a different, person? Are you working kind of with your onboarding or faculty onboarding to kind of develop them and train them for, forward thinking and the technology that's coming that's coming today, tomorrow, or is it more of a culture thing for you, or is it all three?
It's all three. So it's certainly the trifecta of it. The future of healthcare is certainly and education in healthcare. It's got to be flexible.
Sure.
And so we have to be flexible with our students and our faculty and understand the competing priorities and the very high burnout and the very demanding careers that our students and our faculty are coming. But it's being inclusive and it's empowering others with technology as well. And so we do have a robust onboarding. They go through our boarding at our university, but creating the culture comes from us. And I always hear stories of, oh, the negative, and had some of those, but really it's creating the college you want it to be. What would I have wanted if this is my pie in the sky, and it's really caring, and it's
Sure.
caring for others. So you have to exhibit that and genuinely feel that. So it's hiring folks that embrace that caring, that being flexible with students and being flexible with themselves. And then we have also a personalized mentoring. So we mentor faculty, whether they're seasoned faculty or new to the field, because everyone needs a mentor. I have a wonderful mentor, and
Sure.
I'm grateful for that. And then I try to mentor others. So really being there and being present and being inclusive and understanding that the culture is what you create of it and the expectations you set out. And so as the dean and assistant provost of the college, I don't start with what I expect of others. I always lead with what you can expect of me.
Absolutely.
Here's who I am and expect this of me. And if I'm not living up to those expectations for you, let me know. And here's what I would expect of you. So it's leading that and modeling that behavior, but caring should be center of all of it.
Absolutely. Well, listen, this has been great. I'm going to wrap it up with this last question that we always ask. What do you see, or how do you see higher ed in the next, we used to say 5, 10, 15 years, but change is so rapid now. We typically have boiled it down to the next 2 or 3 years. What does higher ed look like from your perspective? And I know you touched on a lot of it during this episode.
Higher ed to be relevant and to meet those has to be affordable. First and foremost, it has to be affordable. It has to be applicable. We have to be able to immediately apply it in our setting. It can't just be theory. We actually have to be able to get use out of it right away. And it needs to be accessible. Folks need to be able to access it however, whenever, and how they want to deliver that. So I think the future is those 3 A's: accessibility, applicability, and affordability. And the future is here, and to embrace that. So yeah, future is
Absolutely.
now.
I can't think of a better place to end it than right there. This is great. Could you let our audience know where they can find you? LinkedIn, Instagram, Facebook? Are you working on any novels, any projects you're working on that are coming out? It's your time to let the audience know.
Oh, you're amazing. Thank you. So I am on LinkedIn, Bonnie Kehm, BonnyKehm. I'm also on Instagram, Nurse Bonnie Kehm, one word. And a few things we're working on in the future. No spoilers with a spoiler. Is check back at Columbia Southern University after the first of the year. You may be interested in and some doctoral programs that would be
Nice.
offered 100% online. And if you want to also connect, I will be at the ENA, Emergency Nurses Association Leadership, in January presenting there as well. But love to connect. Send me a message and look forward to everything you do. And I appreciate you.
Absolutely.